Hi, welcome back to my channel. I'm Sujata Murthy here. In this video, I'm going to talk about a very common condition, that is infection, which is a major cause of a number of infectious diseases. An infection occurs when a microorganism enters a person's body and causes harm. Infections can be localized or systemic. Classification of infectious agents are bacteria, which could be gram-positive and gram-negative. Viruses are obligate intracellular parasites, which only replicates intracellularly. Fungi are non-motile filamentous branching of strands of connective cells. Metazoa or parasites are multicellular organisms. Protozoa are single-cell organisms with a well-defined nucleus, and prion is a unique protein-lacking genetic molecules. There are emerging infections, and an emerging infection is an infectious disease whose incidence has increased in the past 20 years or threatens to increase in the near future. For example, Ebola virus, the latest is COVID-19 infection. It has presented an ongoing challenge to public health. Re-emerging infections can occur. Vaccines and proper medications have led to near eradication of some infections, but however, infective agents can re-emerge if conditions are right. For example, diseases like diphtheria, pertussis, tuberculosis, dengue fever, and giardiasis. Another common cause could be nosocomial infections, which are the infections that are acquired as a result of exposure to a microorganism in a hospital setting. These infections occur typically within 72 hours of hospitalization. Surgical patients and immunocompromised patients are at a greater risk. Approximately one-third of nosocomial infections are preventable. The modes of transmission could be direct or indirect, direct by droplet, aerosol, or skin-to-skin contact. Indirect could be through fomites, for example, clothes, blankets, door handles, etc. Through vectors, for example, mosquitoes, then contaminated food and water, and intermediate hosts, for example, snails. The outcomes of an exposure to infection could be either no infection, subclinical infection, or clinical infection. So if there is subclinical infection or clinical infection, a person can get immunity for that particular microorganism, and or a person can be in a carrier state, or there could be no immunity, in which a person presents with the symptoms of the disease, and if not properly treated, it could even lead to death. If we look at the chain of infection, the first is the infectious agents, which are the microorganisms capable of causing diseases or illness. They are bacteria, fungi, parasites, or prions, which enter through the reservoirs, that is, places in which infectious agents live, grow, and reproduce. That could be in people, water, or food. And the portals of exit from the reservoirs are the ways in which infectious agent leaves the reservoir. That could be through blood, secretions, excretions, or skin. And the modes of transmission are the ways in which the infectious agent is spread from the reservoir to the susceptible host, which could happen through physical contact, droplets, or it could be airborne or through the air. And the portals of entry are the ways in which the infectious agent enters the susceptible host through mucous membrane, respiratory system, digestive system, or through the broken skin. And it can enter into the susceptible host, or they are the individuals who may have traits that affect their susceptibility and severity of the disease. For example, there could be immune deficiency, or the person may be suffering from diabetes, burns, surgery, or even the age factors or other comorbidities. So that is about the chain of infection. And if a person gets infected, the clinical responses to the infection could be inapparent infection, wherein no symptoms will be generated. A person remains asymptomatic, or he can be in a carrier state. Usually there are no clinical symptoms, but host can transmit infection for long periods. And If a person presents with the clinical symptoms, it could be in the form of a mild disease, moderate disease, or severe disease, and there could be residual impairment. And if untreated, it can lead to death. So, as nurses and healthcare professions, prevention and control of infection is our priority. How can we do it? So, we need to focus on frequent hand washing, using insect repellents, ensuring up-to-date vaccinations, and taking prescribed medications such as antibiotics as prescribed by the health professionals, importance of social distancing, and food and water safety. So, for all these factors, nurses and the healthcare professionals need to emphasize and educate the clients and the public for prevention and control of infection. And particularly infection and control or in healthcare facilities, wherein we have seen that more nosocomial infections can occur. So the healthcare personnel can prevent this by following the standard precautions for all patient care. Perform hand hygiene before and after the procedures. Use personal protective equipment to prevent infection. Follow respiratory hygiene, cough etiquette principle. Ensure appropriate isolation precautions. Properly handle, clean, and disinfect patient care equipment and medical instruments. Handle and sterilize textiles and laundry carefully, and follow safe injection practices and proper handling of sharps and needles. So with these measures, at least 20 to 30% of nosocomial infections and other infections can be prevented, and major diseases can be prevented. So thank you for listening, and if you like my video, please do like, share, and subscribe.